Hi, good evening to one and all. I am Dr. Nishant Sharma from Team Voice of Healthcare and celebrating World Sight Day. Thank you, Zydus, for powering one such panel of discussion. Today, our topic of discussion is prioritizing eye health, vision for a healthier future. Today, we'll be delving into the different realms of eye and eye therapy and eye care and treatment. And without further ado, allow me to welcome my panel of experts. We have with us Dr. R. Sudhir, Head of Preventive Ophthalmology and Senior Consultant Cornea and Refractive Surgery at Sankara, Nethralaya, Chennai. Good evening, Doctor. Thank you
Hi.
for joining us.
Good evening. Good evening.
We have
Good
with
evening.
us, yeah, we have with us Dr. Nitin Deshpande, Director, Shree Ramkrishna, Netralaya, Mumbai. Good evening, Dr. Nitin. Thank you for joining us. Thank you. And we also have Dr. Jatinder, Wahi, Medical Director, Greens Medical Center, Lucknow, and Senior Cataract and Refractive Surgeon. Dr. Jatinder has just stepped out of the system, so he'll be joining us shortly once we start the discussion. So we'll have this discussion. I'll pose some questions to each one of you gentlemen, and we'll try to have some kind of awareness and answers for all our audience who are joined. My first question will be for Dr. Sudhir.
Yeah.
Cataract, as we know, is a very common eye condition that can affect vision. Could you explain what cataract is and outline the typical symptoms that we see in cataract and you have seen and observed over the years of your clinical practice, Dr. Sudhir?
Yeah. Yeah. Good evening to all. Cataract is one of the major cause of blindness in the world. So, what is cataract? Cataract is basically the normal natural lens which becomes cloudy over a period of time with aging. It can be due to multiple causes. Could be due to aging, which is a major cause, the diabetes, use of steroids, or due to trauma, or due to inflammation in the eye. These are some of the causes where the lens becomes cloudy. When the lens becomes cloudy, the patient may not be able to see things clearly. There may be some fading of colors, not able to recognize faces. The most common symptom is a blurring of vision and glare at night. So they're not able to tolerate the light, and they're not able to drive comfortably at night. So these are some of the major symptoms, and they also feel the near vision becomes better in some of these patients. With aging, they are not able to the vision of near goes off, but with cataract, some of these patients feel the near vision is better, the long distance becomes dull. And these are some of the symptoms of cataract. And cataract is a curable form of blindness, and there are certain types of cataract which can occur at birth. They are called congenital cataract. They also come at developmental cataracts. So these are because of hereditary disorders, and that
Right.
also has to be cured. And so one of the major symptoms is glare, and there are some cataracts where people feel comfortable when they are at home, but when they go into bright light, the cataract is the center portion, and they may not be able to tolerate light. So these are some of the things which one need to keep in mind. And whenever they have these symptoms, they need to come and have a high checkup to know whether it needs to be operated or could wait for some more time.
Thank you. Thank you, Dr. Sudhir, for setting the theme and the introduction for today's conversation. My next question will be for Dr. Nitin Deshpande. Like Dr. Sudhir just mentioned that one person, one individual should come to the clinic. So how can individual determine if they need a surgery for cataract and what are some indicators to look out for?
Yeah, my best wishes for World Sight Day to all the viewers and my colleagues, Dr. Sudhir, Dr. Wahi, Dr. Nishant. Thank you for inviting me. And cataract is, as Dr. Sudhir has already lined out, that cataract is a very common uh, cause for a vision loss. And very often people start realizing that they have cataract when they can't see clearly even after putting their glasses on. So things start appearing hazy. When people who drive, they start realizing that the halos and glares from the uh, headlights that they see are getting worse. uh, they stop appreciating colors that well, because I have seen many artists, painters who really start seeing shades little differently, color shades, and after cataract they realize that they were wrong and they start painting their paintings again. So I mean, uh, so this is how they realize that they are not seeing very clearly. There is a gradual diminishing vision, And many times there is an unequal vision loss among two eyes. So when you see with two eyes, you don't really realize that one eye has deteriorated more, because a good eye a person keeps seeing, and one fine day when he closes one eye, he realizes that vision loss is quite bad in the worse eye. So these are the different symptoms of cataract.
Right. Thank you, Dr. Nitin. My next question will be for Dr. Jatinder. Hi. First of all, welcome, Dr. Jatinder.
Good
Thank you.
evening. Welcome.
Good evening. So, as we know that cataract is one of the leading causes of blindness in India, and post-pandemic, and given that it's the digital era, can you share some current prevalence of cataract in India? And are there any effective early intervention or prevention techniques that you would like to line out?
Good evening, Dr. Nishant, and a warm evening to Dr. Nitin and Dr. Sudhir, and a very warm welcome to all the audience, and an exceptional thanks to Zydus for this sharing. Let us all share this common platform. Nishant, Dr. Sudhir and Dr. Deshpande is exactly they have informed us that how this basic problem is there, and it is in society in every stance. And see, cataract is a problem. It is not like a problem that it comes with a blow. For example, you have diagnosed dengue, so you know now, oh, you have got a dengue and your platelets are falling. It's a gradual process. We have this lens which has been given by God, which made us see beautifully all the life, and gradually as we grow old or because of some injury or some complications, it's getting dimmer and dimmer and dimmer, and the vision goes dim. And now at a stage comes when, as Dr. Deshpande said, that you feel that the things are not that good, and you run from pillar to post to opticians or to doctors for getting glasses changed, and despite all those efforts, you don't feel that, no, it is not that good that it was earlier. So then you go to an ophthalmologist and they diagnose you that it's a cataract. Now, when you say prevalence, the prevalence word to me now makes no sense, because I feel that as we become 60 or something beyond that, this is bound to come. Nobody can deny. Patients come to me and ask, "Ki sab humko motiyabind hoga ki nahi hoga?" Now, any person who has got a spinal cord, any mammal who has got a spinal cord will have cataract, despite whatsoever the aging goes on. So prevalence is by and far large. Now it's a matter of question that are we diagnosed and are we getting cure for that? Or that is very important.
Right.
Our parents, our colleagues who are above 60, gradually might be the intensity of the cataract might be less or more or too high. That's a different question. So the question is that whether we get a treatment for that. For that, education is must. As Dr. Sudhir told us, these are the causes he has enumerated. These are the ways you can find out that yes, you are having problems. So as you go for a health checkup, heart checkup, and all that, you have to go for an eye checkup also twice a year, so that doctor can decide that you have got cataract and what stage you have a cataract, and let him decide what time you should get operated. Otherwise, your basic need is also required. If you are in problem, you go for cataract surgery. But a basic examination at a dedicated time by a professional, a qualified ophthalmologist, will exactly set up the role of prevalence. Prevalence is there in the society, you cannot deny it. But you have to be educated, the masses should be educated. As you go for other checkups, as you get your car service, you have to get your eyes also serviced twice a year if there is no disease, for a general checkup also.
Right. Right. So, Dr. Wahi, continuing in the same, any effective prevention on early interventions to this condition that have proven helpful?
Dr. Nishant, cataract by and large is an aging problem. If you see the category of cataract which is really prevalent in society is senile cataract. That is the cataract which you get by age. Although there are other causes, as the other knowledgeable speakers told us, there can be a trauma, injury, or a disease process which can set up, or a congenital cataract which can set up a cataract change in an eye, but those segments are too low. So now, how to prevent them? These cataracts, you cannot deny the age, you cannot defy the age, but there are certain things where we feel that the sunlight, the heat, the radiations, and all those things which can expedite the problem which is going on. Certain diseases like diabetes mellitus, you know that it will definitely enhance the disease. So you have to be knowledgeable about your body, because it's your body, your eyes. So to understand the problem, get educated for all these things, and then treat these things as they are, prevent the things which do it, and then you can certainly stop the other complaints apart from age.
Right. Thank you, Dr. Jatinder, for very nicely summing up the different, I would say, prevalences and the prevention techniques. My next question will be for Dr. Sudhir. Presbyopia is a condition many individuals face as they age. So, could you provide some insights into what presbyopia is and the available treatment options that are there?
Yeah. Presbyopia is where the person is finding difficult to read comfortably at a arm length or 33 centimeters. So this is usually because of the loss of elasticity of the lens. The flexibility of the lens becomes not able to focus things comfortably for near. So the simple way people identify is they're not able to read the newspapers. They keep stretching it beyond their. It keeps on going as they age. So it goes beyond their arm's length. Then it finds difficult for them. So they tend to come and approach for the glasses. So this is presbyopia is a aging stage, and it happens for around 38 to 40 years, and it progresses up to 60 years because then once the lens loses complete focusing mechanisms. And this is one of the major causes of refractive errors in the world, where people doesn't know how to what to do, and I think correction of presbyopia prevalence has been increasing very high. So this is like one, and it can be simply treating with glasses. So there are reading glasses which one need to wear. So when somebody has a power for distance, then they need to go for bifocal glasses, or there are something called trifocal and progressive lenses. So these are like when you have a progressive lens, you're able to see things which are at near objects at 33 centimeters. You can see computer, and the entire range of things can be seen. Whereas when you do go for a bifocal glasses, you can see something which is long distance and for reading, but intermediate distance becomes a little difficult for them. And most common things when people start wearing bifocals, they say they're not able to climb stairs properly because they tend to see long distance through a near portion of the glass, which is one of the things which they need to bend their head and then see the steps. So then it becomes comfortable. There are other options like contact lenses, like multifocal contact lenses, progressive contact lens, which can be used. And there are also laser-based surgeries, but they're all very long-term effects nobody knows. And last one is called a clear lens extraction, which is like again where the normal lens is replaced with a intraocular lens, which can focus for near and for long distance. But all these have a complications one need to look when to go for a surgery. Ideally, the best way is to go ahead with a reading glass, which is very simple. They can use it as when required, or go for a bifocals or a progressive lenses. So this will be the options which they have for reading. And for
Thank you, Dr.
yeah, this is just not for reading, for near work, people who are doing stitching or people who are doing needle work, and for even for house wives, or somebody is cooking, or even they wanted to pick stones with the grains, they all need a reading things. So these are very important things. They should start using reading glasses at the age of 40 when they are not able to focus for the near.
Right. Thank you, Dr. Sudhir, for that insightful answer. My next question will be for Dr. Jatinder. So, as an expert in cataract and refractive surgery, could you shed some light on the significance of lifestyle and dietary choices in maintaining a good vision health, Dr. Jatinder?
Nishant, uh, as my previous speaker was talking about the presbyopia, I would like to just add one thing and then I'll come to my talk.
Please, sir, please.
uh, as Dr. Sudhir really elaborated the thing, see what God has given us in as a free gift. Nobody just take cares of that. It is just taken as granted. The way the God has given us a mechanism that we can see at each and every distance, focusing each and every point to that level of clarity with that level of beauty to see the good colors and good shapes and depth perception. That is the wonderful mechanism. That mechanism ages and fades off by 40. So then the things start, and then there is a presbyopia, and now the people are running pillar to post for glasses and other techniques. But this is how, see what the age can do to a person, and this is how the presbyopia. Now coming to your question about what should we do for a good eye health, and again, this needs to be addressed, because now the masses, including young children, are being dragged into this problem. See, eyes were meant to see, and there is a limit to everything. Now, supposing if I ask you, Dr. Nishant, let's go and walk for 4 kilometers. So you say, okay, doctor,
Mhm.
let's go tomorrow morning. But say, then I give you a ring at 9 o'clock and say, no, Nishant, I have changed the program. Tomorrow we want to go for 64 kilometers. You say, sir, it's crazy. It's not possible. How can I walk for 64 kilometers? So similarly, as legs cannot walk for such a long stances, similarly, eyes can also not see for such a long stances. Now we are all into digital media and digital screen. If we are working, there is a digital media. If we are taking some lectures, learning something, if we are relaxing, then also it is digital media. When we are going to sleep, then also digital media. So you are subjecting your eyes, you are using, not using your eyes, now we are abusing our eyes. So first of all, we have to learn the judicious use of the eyes. You cannot walk with your legs for 64 kilometer one fine day, and now you are seeing the media for full 18 hours. I ask my patient, हाँ हम तो 9 घंटे 12 घंटे तक हमारा screen time है. What is this nonsense? If you are a professional, if a time demands that you have to see for such a long time, it's okay. But when after doing such a long work, now you are relaxing again, then you are on a WhatsApp or Instagram on YouTube, and God knows what all is going on. So the question is, to have a good eye health, you have to know about the eyes and its use. Don't abuse it. So you have to do that. This is one point. And if you have to use it because the work says, the profession says, then you have to follow the rule of 20 20 20. That means if you have worked for 20 minutes on a screen, look 20 feet away for 20 seconds, so that it gives adequate time for eyes to take rest. This is just a mechanism to give a short break to the eyes. Then you have to get up from the seat, whether you want to go to bathroom or just to go get a drink, a cup of coffee or water, or talk to somebody. Just move away from the screen after 20 minutes, 30 minutes, give some rest to the eyes, and then come back to the work. So this is my first message. Know how to use the eyes, and then if you have to really use it, involve this thing. Third thing is that now there is no fun if you are, this country has got a climate which is exceptionally hot for say around 8 to 10 months in 12 months. So you are subjected to intense heat. So why not use the proper polarized sunglasses? Why not to use proper sunshades as other countries do? Why not to, and even if you are using power glasses, why not take extra screens on that, or use a cap or something like that? Because our country is now having intense heat for majority periods of it. So prevent your eyes from, because you go outside, then prevent your eyes like this. Number three, you have to educate our children about eye injury. We are now not going out for playing games as we were doing earlier. We are all subjected to inside screen and computers. But once we go out, we have to tell our children how to prevent, how the eye injury can take place, and how to prevent these eye injuries, how we have to be cautious. So these are the important things. So far as foods are concerned, I have just one message to all the young children who are listening to me. Any colored fruit or a vegetable is boon for you. It is a miracle of God. Just have it, because it has got some valuable beta carotenes which will give you very good eyesight, which will give you very good eye health. Vitamin A is a good source. You know the sources. Just go for it. So any colored fruit or colored vegetable, just run for it. And be careful to wash it properly, take it in a good way, and consume it into a daily basis health. Moreover, the last thing, please, as you go for other body checkups, as you go for your car service, as you go for other mobile service, please get serviced also, especially eyes, at least twice in a year. Thank you.
Thank you, Dr. Jatinder. My next question will be for Dr. Nitin, in continuation to what Dr. Jatinder was just talking of. So we know computer vision syndrome and digital eye strain are becoming increasingly common due to prolonged screen time, as very rightly pointed out by Dr. Jatinder. How do you feel that these issues contribute to the dry eye disease? And what steps do you feel can individuals take? A certain were obviously enumerated by Dr. Jatinder. In your opinion, what do you feel steps can be taken by individuals to manage these problems in this age of digital screens? Dr. Nitin, please.
Yeah, as Dr. Wahi has rightly pointed out, that people are really abusing their eyes now, and screen time of 10 to 12 hours has become a routine for many IT professionals. And again, after you finish your work, you're again on screen for some reason or other. And this is causing a lot of computer vision syndrome issue, especially post COVID. This issue has gone during COVID and post COVID because we are more digitalized now. Everything is on screen. Your kids have classes on screen, and we are used to using all the apps and phone more. And the simple thing how we can prevent, I tell patients, is that please don't forget to blink, because every time you blink, your tear film resurfaces over your eyeball or surface, what we call as the ocular surface. Now, when we are focusing, we kind of forget to blink. So, blinking is extremely important. Those who have very extensive times, longer times, we do prescribe them some lubricants which are preservative free. Now, these lubricants are similar to your natural eye drops. They are constituted in such a way that they cover your ocular surface and give you lubrication and prevent dry patches. Now, these dry patches cause irritation, watering, redness, reflex watering. So, all these things are prevented by having a healthy ocular surface by blinking more frequently, using lubricants. Then there are some good foods like omega fatty acids. Now they help in improving your natural secretion. Or Dr. Wahi has also pointed out the nutrients that help you improve your eye health, your ocular surface health, which is also now ocular surface health is something that ophthalmologists have really focusing upon since last few years, because even we were little negligent about this ocular surface health probably few years back, and nowadays we have a lot of good diagnostics to know to evaluate ocular surface, like what is, there can be different reasons for a dryness, so we can evaluate that, whether it is evaporative, whether your glands are secreting less. So there are different, we are able to now judge and evaluate what are what could be the probable cause, what could be the subtype of a dryness, and now we have drops to specifically treat those subtypes. We have a lot of new technologies like LipiView to evaluate. We have good diagnostics like LipiFlow or IPL, which can really treat those subtypes and improve the ocular surface. I think dry eye evaluation and treatment has come a long way. Of course, if people take good care, they you do preventive practices like blinking, using lubricants, restrict your screen time as much as possible. So these simple things can prevent dryness, can prevent vision syndrome, and hopefully they can prevent any treatment that is further required. So, yes.
Thank you, Dr. Nitin, for very nicely elaborating that topic. Now, my next question will be for Dr. Sudhir. We have always heard since our childhood that sitting too close to a television is going to harm one's eyes. So I want you to elaborate this particular topic. And is there a link between excessive screen time and deteriorating eye health, or have been what have been we hearing since our childhood? Over to you, Dr. Sudhir.
Yeah. Yeah. So basically, sitting close to the TV means the children may have refractive errors where they're not able to see things very clearly when they're sitting at long distance. They tend to go and sit closer. Same thing happens in the schools when they're not able to see the blackboard. They tend to go sit closer and see. So that means they are having some kind of refractive errors. But actually, sitting close to TV and watching in the previous era where they have cathode ray tubes, the screens, there's a chance of radiation and all that. Currently, with the new LED screens and all that, the radiation is much lesser. But the most important thing is actually at least sit at 6 meters, which are much comfortable, so that your eyes are relaxed. You don't need to strain and see things, and you can blink. The blinking is where, like when you sit very close, you are concentrating and you don't tend to blink. When you don't blink, again, it causes dryness. Just adding on to what Dr. Nitin and Dr. Wahi has said about the dryness, is like when they sit in front of computers for a long time, few more things which they can do: increase, like blink constantly, take breaks and work. There is something which they can also do is increase the font size and work. So I tell all my computer users, don't sit very low font size, because you are straining your eyes and your eyes doesn't blink when you're looking at a very small font. Try to use a bigger font size. When you're using laptop, they say, yeah, you can have an extended screen with a bigger monitors, and you can again feel very comfortable. There's one small tip I can tell, since I'm also a cornea specialist. So the oil glands which are there in the lids, which tend to lubricate, and when they are not secreting properly, then there is a the dryness occurs. That's called the evaporative form of dry eye. And a simple way to clear this is just doing a little hot fermentation over the lids and gently massaging it. It's just you can take a kerchief, dip it in hot water, squeeze all the water, keep it on the eyes for 2-3 minutes, and gently massage the lids up, down, and wash your face with the soap and water comfortably twice or thrice. That oil secretion becomes more smoother and they be comfortable. So other simple way is they can use the warmth of the cup when they have a coffee. So when they are working for long hours, they tend to have coffee 3-4 times. So the best way is when they are half cup and it is warm, they gently rub it over the lids and then do the hot fermentation. Because most of the time they don't even going and getting a hot water kerchief and dipping it and putting it is impossible. So they don't do it. But when they do this, they tend to do it more comfortably and they feel very happy. So this is what we need to look at. Coming back again, sitting at watching things at very close in the digital era, they also cause myopia. So in children, it is very, very important. They need to have outdoor games, and they need to spend time outdoors, because when they start seeing more closer, it tend to cause refractive error called myopia. And during COVID, we found many of them had progression in myopia very fast because they were not able to go out and play naturally. So this is again very important for all the parents to encourage the children to go out and play. Try and keep the screen time much lesser, and if they take care, the myopia can be controlled. At least it cannot be stopped. At least you can control myopia progression.
Thank you, Dr. Sudhir, for elaborating that. Dr. Jatinder, my next question is for you. Being a clinical practitioner, what are some common myths and misconceptions that you have seen across different diseases that are spread across eyes, be it cataract, be it glaucoma, be it presbyopia, young children, old age adults? Some common myths that you would want to bust through this medium of this virtual awareness that we're doing.
The as Nishant, Dr. Sudhir told, we have been told from right very long time that अगर आप ज़्यादा टीवी देखेंगे तो आपकी आंख खराब हो जाएगी. And as Dr. Sudhir rightly pointed out, there is no such relation between watching TV and then getting the eyes spoiled. There is no direct such relation. But the only thing is that if you are having a refractive error, you go close to the TV to watch the screen. But there are certain things which are of common sense. That means if you are watching the TV or the screen with a disturbed contrast, that means you have shut down all the room lights, and or else you are just hiding in a bed sheet and watching a telephone or viewing a telephone or a mobile phone. So I mean to say there has to be a reasonable amount of background light, and then if you are watching the distance at a proper distance, as Dr. Sudhi told, the media, and for a proper time, then there is no harm with that. So this is a myth that अगर आप ऐसे टीवी देखेंगे तो आंख खराब हो जाएगा. No. Agar if you see the TV in a right manner, at a right distance, with the proper background lights on, and for a right schedule of time, there is no harm in that, because that is meant for seeing only. And now, as he already told us, that there are no cathode rays TVs now. There are just LEDs or these LCD TVs. So they are not going to harm you like that way. And moreover, now we have got some big screens also. And same thing applies for the laptops also.
Right.
Now, this laptop and all these pictures which come on these screens are dotmatic pictures. They are made up of numerous small dots. So if you really increase the font size, there will be a relaxation to the eyes. You don't have to strain that much. But then you have to take care of proper contrast, the proper background illumination of this thing, and then the font size, which makes the resolution become an important factor, which makes it more comfortable for your eyes. That is the angle that subtends to your eye. So that makes the things more clearer, and then you are in a comfortable state. Moreover, they have got this is one aspect about TV viewing and this also. Then, as you asked about the other diseases, the people have got a myth about cataract in two fancy ways. I don't know how the things are coming out from back. कि गर्मियों में मोतियाबिंद नहीं कराना. You don't have to get operated your eyes in summers, because your eyes will become bad because you will have sweat, because you will have this, that, I don't know. I think this was really good information, say around 20 years back, so 25 years back, when we were really getting incisions and then sutures, and then that green shade, and there was no AC or fan or something like that. It was, the weather was hot and humid, so they really were worried about those sweat and all those things going into. But I don't have a sweat still in my eyes. I don't know how that was the concept, but people do have a concept कि गर्मियों में operation नहीं कराना है. I want to say very clearly on this platform, this has got no clinical relevance. You can get your eyes operated any part of time, any part of year, any part of day. But the only thing is that you have to go with the precautions and instructions what the surgeon tells you post-operatively about the care of eyes. So this is one myth which has to be busted. The second myth is that आपको मोतियाबिंद तब तक नहीं कराना है जब तक हाथ दिखना हिलना ना बंद हो जाए एंड बहुत पक ना जाए, एंड दैट मीन्स दे आर टॉकिंग अबाउट grade 5 or something in the clinical sense. But that also is a myth. There has got no relevance. We have to now tell the society that now we operate through 2.2 millimeters. The size of entry is so small. We have to go inside, work inside at a very small space. So if the cataract is hard, it is a real challenge for the surgeon to cut it, break it, emulsify it, and suck it out. So if it is medium soft, it is good for the surgeon and it is good for patient also, because that prevents complications. It's a myth कि जब बहुत पक जाएगा तभी कराइए. Don't go for that. When it is reasonably good and the surgeon says कि now it is a fair enough time to get operated, please follow that. And it becomes a good win-win situation for surgeon, as well as it is a win-win situation for the patient also.
Right.
The third myth about the conjunctivitis and all those things is that कि वो एक दूसरे को देखने से हो जाती है. No, there are certain diseases which are really airborne, but that too has to be fomite driven. When the particle from one eye or a fluid from one eye goes to other eyes, or you touch something and it goes, it is not just by seeing somebody you get a conjunctivitis. It doesn't happen so, because then we being the surgeons were at a very horrible place, because we see patients day and night. So that is a big myth. The only thing is, the correction point is, do not touch your eyes in any point of time. If you really want to touch it, wash your hands, touch it, and then again wash your hands to make your hands clean. Because then you will not spread the disease from eyes to some other place, and from that place it will not go to any other person. So that myth has to be busted, that eyes के देखने से हो जाता है. It's not so. The only thing is, golden rule is, do not touch your eyes, whatsoever it may be. If you really want to touch it, wash your hands, and then again wash your eyes. And the last myth which is there about glaucoma. Now they say कि अगर ये हो गया तो then you will lose your eyes and there is no treatment, it's God's this thing. No, glaucoma has got a treatment. It is known as sabal vayu in Hindi or kala motia in Hindi. It is, people say white motia nahi hai, उसमें तो रोशनी वापस आती है, काला मोतिया में नहीं. No, it's not like that. Now there are beautiful medicines available and there are beautiful surgeries available. Surgeons have gone to an extent to give you everything they want to give you back. The only thing is, what is lost is lost. That will not come back. But then it's a real hard time to go early, get a checkup done, and get a good eyes. That is what I want to say.
Thank you, Dr. Jatinder, for that wonderful, busting the myths and the misconceptions that we have. Dr. Nitin, my next question will be in continuation to what Dr. Jatinder just spoke of, glaucoma. So we know that it is another significant cause of vision impairment in India. So can you please explain to our audience what glaucoma is and discuss the different available treatment options? Dr. Nitin, please.
Yeah. So glaucoma, Dr. as Wahi has pointed out, that there are a lot of misconceptions about glaucoma. कि अरे काला मोतिया, once you have, your vision is gone, or it is not recoverable, or people get really scared and there is a massive psychological impact. So glaucoma comes with a lot of psychiatric issues also, and it comes. So glaucoma is basically a nerve issue. When there is a raised eye pressure, there are different factors. The most important factor we know is a raised eye pressure. And the second factor probably is altered blood circulation. So that leads to optic nerve injury. Now this injury is very typical. It occurs at the poles of the nerve. Now your nerve is like a donut and there is a hole in the center which is typically 30%. And once this hole, this 30% starts expanding into 40-50%, that indirectly indicates that there is some nerve tissue loss. And that is how ophthalmologists come to know that there is something going on. Now, raised eye pressure is one of the most commonest thing that So it is very important that, that's what we do in our clinics, is we screen all 40 plus people for eye pressure. So it is very important that you have to check your eye pressure twice a year, periodically, especially when you have a family history. Like if your blood relative has a glaucoma, your risk becomes 5 times more than a normal person. Uh, One point I forgot to mention was prevalence. Like it is a very common disease, and almost prevalence is 1 to 2% in a population. And these studies were conducted in urban as well as rural population. And problem is in urban, at least people have some education to go and really go and check their eyes. So they are detected in some way, at least at some stage. But in rural India, awareness is very bad. Their access to healthcare is very bad, and the vision loss because of glaucoma is much higher in the rural population. Unfortunately, even today, 50% of the patients come with a lost eye to the doctor. So, propagating awareness about glaucoma is extremely important. Government has been doing it. Glaucoma Society has been doing it by every year. Glaucoma Day is celebrated and awareness is propagated. Uh, so, glaucoma basically is a nerve injury, and if it is not controlled in time, it can progress, and which can potentially lead to a blindness in a person. Now, a person will not know that he has glaucoma unless he goes to ophthalmologist, because in glaucoma, the early vision loss is in the periphery. So, when there is a peripheral vision loss, unless that loss extends to the central part of your vision, you don't realize it, because probably the other eye is good and it is compensating for this eye. So that is why many people realize it at a very late stage that they have some problem. uh, again, annual checkup is extremely important to detect it early. Now, if you have again family history is a very important thing. Then glaucoma can occur in any age group. So there is a myth that again it happens for only old. No, it can happen in young. It can it can happen because of injury. It can happen because of some swelling in the eye called uveitis. It can happen if you use steroids in an uncontrolled manner, that it is not being monitored by a medical practitioner, and if you keep on putting steroid drops for red eye or whatever it is. So unmonitored excessive use of steroids can cause it. uh, Again, now we see these mature cataracts less and less in the country, because cataract awareness is very high. But if your cataract is over ripened for some reason, people tend to ignore it, then even these over ripened cataracts can lead to a glaucoma. So these are different common reasons for a glaucoma. And
Right.
uh,
Talking about some treatment
very
options for glaucoma as well, right?
sorry.
Talking about some treatment options that are available for glaucoma,
Yeah.
Dr. Nitin.
So, what is the treatment aimed at? Now we know that by reducing eye pressure, we can control progression of glaucoma. So there have been multiple studies in the past that proved that bringing pressure down will uh, stabilize glaucoma. However, we don't have any means to really increase the blood circulation. But so we know that even when there are one subtype of glaucoma called normal pressure, where pressure is not high, but still there is a progressive loss of nerve. Now, even in normal pressure glaucomas, we know that reducing eye pressure will protect us. So, how do we bring pressure down? Now, pressure can be brought down by wonderful drops that we have nowadays. So, first line treatment is drops. So, we give drops to bring pressure down to a level so that there is no further progression in the glaucoma. Now, there are newer modalities like some lasers, where what happens is, because of 2 or 3 drops, when the when it crosses 2 or 3 drops, people become little negligent. Sometimes they forgetfulness. Then there are some side effects because of drops, like ocular surface dryness, redness, irritation. Very elderly people get some other related issues with drops. So the kind of uh, compliance part becomes very poor when drops go on increasing. So in those patients, we offer them lasers. Like there are some very simple OPD-based lasers like selective laser trabeculoplasty, which can aid in bringing pressure down to some extent, so that number of drops reduce. But however, there are some patients where glaucoma still goes on progressing even after giving adequate number of drops or their eye pressure just doesn't budge, it doesn't get controlled, then we offer them surgical options. Now we have wonderful new surgeries now called microincision glaucoma surgeries, which can be offered in little earlier stages of glaucoma. Now microincision means cuts are very small, there are no stitches. That's come with the conventional surgeries. Recovery is very fast. These microincision surgeries can be combined with other cataract surgery. So this helps in reducing morbidity, quicker recovery, and brings down pressure to some extent so that number of drops reduce. However, when the glaucoma is more advanced, we have to do little more conventional surgeries like trabeculectomy or Ahmed Valve. Now, these surgeries they allow the fluid inside the eye to flow out of the eye in a controlled manner. So, so this is the spectrum of treatment from drops till surgery. So, this is what a modern glaucoma surgery is today. Treatment is
Thank you,
today.
Dr. Nitin, for describing your knowledge and sharing your knowledge about glaucoma with us. My next question will be for Dr. Sudhir. I'm trying to now switch the conversation to public awareness and public education. So, in the context of eye health, Dr. Sudhir, when do you think a parent should have their children's eye tested and their own eye tested in a span of a year? So, educate through the medium of this panel to all the viewers here, please. You're on mute, Dr. Sudhir.
I'm sorry. Yeah. So the eye examination is, as Dr. Wahi, Dr. Deshpande has said, it's important to have a regular eye checkups. So there are a few things which we need to understand. What is the eye checkup is? It's a comprehensive eye examination, which includes to know what are the risk factors the patient has, what are the symptoms, get a complete eye refraction to know whether they have to wear glasses or not, then to have a eye pressure check, and then to have a dilated examination of the retina. So, and also there are few other things which we do to check on the alignment of the eye and mobility of the eyes. If all these are things are part of a comprehensive eye examination, when you go to an optician, it is just what they do is only a refraction. They may not do it. Then we need to examine the eye under magnified things, which is called slit lamp examination, where you can magnify the eye and see each and every structure. Certain structures can be, we can make a cut section and look into it. And so all these are part of a comprehensive eye examination. So when we do a comprehensive eye examination, we do not miss any disease. So shortcut examinations are not advisable at all. So ideally, please have a complete eye comprehensive eye examination. Coming on, when should we do? For a children, when you have a family history of congenital diseases, or even any child who has any problem at birth, they need to go and checked up immediately as early as possible. They may have white reflex in the eye because they have a congenital cataract. Sometimes there are some tumors. All that we need to identify. Of this eyeball is not well formed, the cornea will be very small. Certain conditions, or eyes are not straight, they are crossing. These are things which, when you start seeing, or there is a discharge in the eye because there is a passage where the tears go in from eyes to the nose is blocked, they have a discharge. So all these conditions, whenever you have any symptoms like redness, or the child is not able to see the parents or not able to follow the light, these are things which they need to have immediate checkup. Otherwise, ideally, checkup anytime before 1 year once is ideal. Generally, you need to club it with a pediatrician. The child goes for immunization to the pediatrician for multiple times during the first 1 year. So you ideally club this with their eye examination. That is the best way. There are conditions like retinopathy of prematurity, where child is put on oxygen. Those are conditions where you need to have immediate checkup. So that is within 1 year. If you have any symptoms, immediately you have to have it. Otherwise, whenever your pediatrician identifies any signs which needs or symptoms, immediately they have to refer to an ophthalmologist. Then coming back, as soon as they go to the school, before the age of 5 to 6 years, they need to have one more eye examination, because this is the time when we can ideally pick them and treat certain diseases. Like if they have a refractive error in one eye, the other, or the refractive error in both eyes, and if they don't wear glasses, their vision may not improve. So there are something called lazy eye. So all that can be treated by treatments which are available, by patching the good eye, allowing the lazy eye to exercise, see things, and that can be picked up only when they have a regular eye examination. So before, as soon as the child starts going to the school, they need to have one eye examination. Ideally, school screening is where we can pick up all these things, because whenever even we say go for an eye exam as soon as the child is around 5 years or 6 years, most of the parents do not bring them. So the best way is to collaborate with the governments, and also participate in the school eye screening programs, where we can easily pick up all these things and treat them. So then from 6 years up to the age of 15 years, once in a year, it is ideally must, because they can develop certain refractive errors, because that is very prone, and that needs to be treated immediately. And then the most important group is like from 20 to 64, or the working group. So most of the times they neglect, because they are concentrating on their work. They don't even go for eye checkup. Again, they may have eye strain and other problems. So every year is a recommendation from that. And at the age of 40, we have talked about presbyopia. So, and many of the diseases tend to occur at the age of 40. If you have diabetes, you start getting it diabetes, and complications of diabetes are seen in eyes, and you need to have it examined. Glaucoma, if you have a family history or you're prone for glaucoma, all that comes around the age of 40 years. So these are things like, once you are at 40, a must to have a complete eye examination, and every 6 months to 1 year is ideal. Because most of the time the compliance to these treatments are very, very poor, even if you say come once a year. So we did a study in diabetes to find out how many of them come for regular eye checkup. So we found if they are diabetic, only at least many of them never even go and have an eye checkup done, which is absolutely we can't pick up the disease like a diabetic retinopathy, where there is a hemorrhages, bleeding inside the eye, and if it is not treated in right time, the loss of vision cannot be retrieved back. So these are the areas where they need to have a regular checkup, and the frequency increases if they have eye diseases. So these are certain things which one need to follow, so that they have a good examination. So one important thing is comprehensive eye examination. Any symptoms like redness, or the child is not able to see the blackboard, they immediately need to come and see. And other one more children have is something called rubbing eyes. This is because of allergy. They tend to rub eyes, and when they start rubbing, the cornea shape changes, and they develop what is called keratoconus. There is a frequent change of glasses, and that can be prevented by treating the allergy in right time and avoid rubbing. So rubbing is one which we need to see. If the child is rubbing, immediately we need to take them and have a complete eye examination. So comprehensive eye examination is must. Yes, if you want to change glasses, you can go to an optician, optometrist, but a complete eye examination is generally done only by a ophthalmologist.
Right, right. Thank you, Dr. Sudhir, for very nicely summing that up. Now, as we move towards the last topic of discussion for this particular panel, which will be public awareness and public education. So, as we know, World Sight Day calls for a very collective effort to raise awareness about blindness, about vision impairment, about the different diseases of the eye. So, my question to start with will be Dr. Jatinder. How can the medical community, the government, the civil society collaborate to prioritize eye health? Like Dr. Sudhir very nicely pointed out, screening in the schools for children. So more initiatives that you can suggest or you are a part of, where we are doing a collective, a collaborative effort to improve eye health, to improve the awareness for eye health. Over to you, Dr. Jatinder, please.
Dr. Nishant, so far as this problem is concerned, it is not just a clapping with one hand. It has to be a byway, and that is how once the one hand should be of the community and the other hand should be of the agencies. Now, agencies can be anything per se. It can be schools, it can be banks, it can be working offices, and all those things. So, what I mean to say is that so far as schools are concerned, schools do call a ophthalmologist or an optometrist to do a generalized screening. They take a vision test or a color vision test, and then they diagnose ki so many children in the school, they really need to go to an ophthalmologist. They inform the parents. But on the other hand, we as an ophthalmologist also should definitely find out sometime, say around 15 minutes, 20 minutes time, to talk to the principals of the known schools, in at least in the schools in where our children are studying, that we can go and address the combined masses about the importance of vision, how to use the eyes, how to handle the eyes, what to eat, what not to eat, what care to take for digital media and all those things. So that can be one aspect. This is in the school where we as an ophthalmologist can take an initiative and go ahead and take the lectures on a no profit loss, where the school can just give us a audio visual system and we can take 15 minutes to educate the teachers and as well as the students. The other thing is there is a very important segment which is known as banks and all these IT hubs. Now they are into day in day out sitting on computer screens. There they can be calibrated, or certain clubs like Rotary Club or Lions Club or and Wheelers Club, where the ophthalmologist can just join hand to hand, take these lectures, and then inform the society, these bank peoples or airport authority peoples, and I do it regularly, and you would be surprised to know that they invite us very lightheartedly. Just give us time. We just take out 15 minutes, 20 minutes, and they really appreciate it. So, as if you can go to SBI, talk to SBI head, and he can allow all the branches to club in, whether some physically, some digitally, and then you can go on with the lectures. Then the third thing is that now the medical pharma companies, they are really printing so much of material, and I feel personally that much of that material goes into waste, because the other end, that medical community does not go hand in hand with this thing. Their efforts really go to some extent, they go to waste, because they are not utilized in a proper way. The way they are printing the booklets, the sheets, and all those things, you have to just taking them from the medical companies and keeping it on your table doesn't work. You have to give it on the reception table, because from there they can stick it to they can tear a sheet and punch it with the in the file, so that at least it reaches to the patient's place, where if the patient doesn't read, no matter, their grandparents may read it, their father mother can read it, and then the information can flow. If 100% there is no flow, at least 40%, 30% can be a flow. Moreover, you should have, if you have got a digital screen system in your hospitals, you should have these common talks what we are having recorded on a pen drive, and let it be there on the screen in the waiting area. Let the people listen to it. Some may listen, some may not listen, some may do anything, but at least something will go into their head. So these efforts have to be taken. Similarly, we celebrate this World Sight Day and World Eye Day and all the Glaucoma Day, but justification has to be also done. Unless we do justice the things, there has to be an effort. The efforts, जैसे कि बिल्कुल मेरी बेटी की शादी है और मुझे सबको कार्ड बांटने हैं, सबको बुलाना है, I have to call everything and do arrangements. Similarly, I have to participate. I, being an ophthalmologist, feel like I have to participate, and that is how the society will come back to me. Thank you.
Thank you, Dr. Jatinder. Very, very, very lovely answer. Thank you. Dr. Nitin, similar question to you. Talking about the collaborative efforts that healthcare community, the government, civil societies, any initiatives that you are a part of, that you're aware of, that you'd like to discuss of, please.
So, celebration of this World Vision Day itself is a great initiative, because this creates awareness. This brings not only ophthalmologists together, but cross specialty collaboration also is highlighted here. Like, it could be a diabetologist who is referring the patients for a regular eye evaluation of diabetic retinopathy, or a rheumatologist who is sending for any side effects due to the medicines like HCQ, or it could be a physician who is referring his COX patients or TB patients to see whether those drugs are causing any side effects. So the cross specialty collaboration, as Dr. Wahi also pointed out, is very, very important. Then public awareness. Now we are not a very big organization, but we are in 5 locations. So wherever in our localities, we do school screenings, because we know that myopia, something like a myopia, which is a pandemic in India now, and you know that the incidence of myopia has gone to 25% in kids, so that needs to be detected early. Incidence of high myopia has gone up 8 to 9 times post-COVID. So these are real-world issues that we need to, because if you detect myopia early, you can control it, so that it doesn't become a very high myopia leading to retinal problems. Early detection of diabetic retinopathy or a glaucoma can prevent severe vision loss. So early detection is the key, and all the cross speciality as well as social organizations, like we go to the Ganesh Mandals, because in Mumbai, Ganesh festival is very big. So we go there, we give educational lectures to a lot of people who gather there. Or we have large Durga Pujas in Mumbai. We have a large Bengali population where almost 5 lakh people visit one Durga Puja. So, so these where people come together, this will be this is the right place to reach out to them and tell them importance of eye care. Not only eye care, other healthcare issues, but um, we being a eye care organization, we make sure that we go there and deliver lectures or at least put a stall and distribute our educational material there. Again, simple things like those who already are coming in contact with you, like people walking into your clinic, they are also the ones whom you can easily educate. So educating people, making them aware, like a glaucoma patient coming to you, you have to tell them that please bring your family, your blood relatives for a checkup because they might have a glaucoma, and if it is detected early, you can prevent severe vision loss. So these are the simple interventions that a one individual ophthalmologists do. But when there is a World Vision Day where all ophthalmologists come and do it together, that really takes the whole thing to a different level. So this initiative itself is amazing, and again I congratulate Zydus to come up with such platforms to propagate such ideas.
Thank you, Dr. Nitin, for that wonderful answer. Dr. Sudhir, my mic is towards you now. What, in your opinion, can be done, and you are a part of, and you deploy in your day-to-day practice for improving the general public awareness and those steps and initiatives? Over to you, Dr. Sudhir.
Yeah, I think both the speakers have enumerated most of them, like the school eye screening. The other thing which we also look at is the industries, where we go and tell them about protective eyewear they need to use when they are where chance of injury to the eyes. So these are some many of these industries, and there are unorganized sectors which are very important, where they are not aware of it, like the use. Bricks, breaking stones, and all those things, or high-speed drills. These people are not aware, so we need to educate to them. So we try and doing it in the unorganized sectors also. The school screening, which we do it on a large scale, then we do an industrial occupational eye health. We go to and give awareness to all these factories where they are prone for injuries, and we also give apart from all these things, like diabetic retinopathy screening, clubbing it with diabetologists, and slums. We also do screening in slums, because they are again the awareness is very poor. Apart from all this about eye awareness, there is also something which is very important, which is called eye donation. We also have eye donation week, which was celebrated to last few weeks back, end of September and first week of October. We do an eye donation fortnight. So one of the myths is, many of the conditions when they have problems, they say, can my eye be transplanted? Actually, we can't transplant the eye. It is only the black portion of the eye, which is called the cornea, which can be transplanted. So we tell them, we educate a lot of people, because their corneal blindness is again one of the major causes of blindness, apart from cataract, glaucoma, diabetic retinopathy, and that can be cured only with eye donation. And where see, the eyes are going waste after death, we tell them to motivate people whenever they come across death, to educate the relatives, tell them to donate the eyes, and you're gifting eyes to two people. Now with multiple, like we can also do something called laminar keratoplasties, like deep lamellar keratoplasty, or deep anterior lamellar keratoplasty, where one eye can be used for two people. So when we look into it, so from a single person, we can even gift this to 4 different people. So eye donation is very, very important. We create awareness about all these things. So that is also one of the activity which we do at Netralaya. So these are some things like, and the last and the most important thing is, we tell them about self-eye testing, which are very, very important. So many of the times we don't even test ourselves. Simple thing, now World Cup is going on, and if you're not able to read the scoreboard, that means something is wrong. So you need to go and check. Again, simple thing is newspapers. You're not able to read the small font. That is again what we do in testing. When that is the letter size of N8, if they are not able to read that, that means you have a reading problem. So
Right.
simple things which you can do as self-testing. And again, close one eye and look at objects. and close the other eye and compare between the eyes. Many of the times, one eye may be lazy, other eye is good, and you can pick it up by doing this simple test. And now we have a lot of apps where you can do a vision testing at your home, and you can also do a telescreening with your. So we also during COVID we did almost like 25,000 people were teleconsulted because they were not able to come to the hospital. So you can do checking up at homes, and you can self test it. You can document it. You can take a good pictures with your mobile phone again, and you can transmit it to the doctor and get your telescreening done. So all these are things which we tell them, create awareness. So do not wait. So sometimes they say, sir, we didn't get you an appointment because of which my vision has dropped down. That is not the cause. So you can do a telescreening, get an appointment, you can go to emergency and all these things. So any of these are educating people. Again, compliance to treatments. When medications are prescribed, they need to follow them well, keeping sugar under control. All these are some things which one we need to create awareness among them. And policies like all these policies, there are a lot of policies which the government has, but they are not fulfilled well. Like drivers, when their license is tested, many of the time they don't even have a proper eye testing, but they get a license done. So we need to have a vigilance how these tests are properly done or not, and then give license should be given. Otherwise, there must be a people who do not see well, they may be driving and they can cause problem to us. So we also did a screening for lorry drivers and all that. So this is one or other activity which we have done at Shankar Netralaya.
Thank you. Thank you, Dr. Sudhir. So with this, I'd like to bring this panel of discussion to a closure. I'd like to first of all thank Zydus for powering this particular strong initiative on this World Sight Day. Secondly, I'd like to thank all the viewers who have engaged with us, showed engagement, showed their audience. And thirdly, and most importantly, I'd like to thank my panelists, Dr. Jatinder, Dr. Sudhir, and Dr. Nitin for sparing time out of your schedules and stepping up with Voice of Healthcare and creating this awareness for World Sight Day. So thank you and have a good day, gentlemen. Thank you. Thank you for your time.
Thank you.
Thank you.
Bye bye. Thanks a lot.
Bye bye.